Siapa boy? Okay, sudah kenyang lah.
Terima kasih.
So my name is Ashwin, and today I'm going to be talking a little bit about photobiomodulation therapy. So that is essentially what Ventros ion laser device is about. So I'm from Penang essentially, and I have a clinic in Island Glades. I run a practice with my father there, and the clinic has been there for about 30 years now. So we have been involved in photobiomodulation therapy for about a few years now. But previously, the devices that have been used were very big devices, costing about $15,000 to $20,000, and technology, I wouldn't say anywhere as advanced as the ion laser device. So this technology has been around from Russia, from Germany, from China, but now what you guys have is actually something which is very interesting and very different. So I'm going to be talking about it and just give you some explanation about it so you have a good understanding about what you're using. Is that okay?
Yes.
Okay. So this is a big word to pronounce, photobiomodulation therapy. I prefer hands-free. Easier. Okay, so photobiomodulation therapy, from the word itself, it explains what this cold laser or cold light therapy is about. Photobiomodulation, photo means light, and biomodulation means bio is the cell and modulation means changing the cell. So this is actually using light to change the cell. So it's using a non-ionizing light source, which can either be laser, LED or broad spectrum. IM laser is using diode based, which is actually more powerful than the LED. So these are the lasers that we are familiar with when we watch movies and we see laser lights and all these kind of things. But this is using a different spectrum. So this is in the electromagnetic spectrum, which is known as the visible light spectrum, between 400 to 700 nanometer. The ion laser uses a specific wavelength, which is 650 or 650 nanometer, or near infrared. It's just close to near infrared. So we have radio, TV, microwave, X-ray, all they use different wavelength frequency. So you can see the frequency is somewhere around here. The orange zone is the 650 nanometer. Why they use 650 nanometer is because multiple clinical study and research over many years, they have actually found out that this range, this frequency is actually very therapeutic, very beneficial for us to get a health benefit from this. So this technology to us is something that is quite new, but actually it has been around for some time already. In fact, one of the first people to come up with this science behind this technology is none other than Albert Einstein, and that was in the 1920s. So that is almost about 100 years ago. And Albert Einstein, he created a therapy, a scientific understanding using physics, and he found out that using this technology you can actually get health benefit. Then about 1960s, it started to get more and more in-depth in the research. So the process is something to do with something in our cells. We have a few trillion cells in our body, something like about 20 to 30 trillion cells in our body, every one of us. And in each cell, there is a nucleus, which is the center of the cell, and then there's the mitochondria. The mitochondria is something like the ECU. The car has the ECU, so inside each cell there's a mitochondria, and inside that mitochondria is something called ATP, adenosine triphosphate. So in that adenosine triphosphate, when the laser light enters and penetrates into our body, it will stimulate something called cytochrome C. And the cytochrome C absorbs this light and will stimulate the mitochondria to produce ATP. The ATP is a very interesting process because a lot of anti-aging and all the disease processes that occur in our body, when we compare ourselves from our 20s to our 30s and 40s, the aging process that occur on an external basis and on an internal basis actually is occurring because of the ATP. The ATP holds a lot of DNA, and inside this DNA is the key to a lot of our aging processes and disease and illness. So a lot of new technologies nowadays are actually going into ATP, into mitochondria to understand this technology further and to stimulate it. For example, Singapore, they have spent something like about 80 million Sing this year in research on cellular technology, because they understand that this is the way forward, and they understand that there is something to do with the cells. When they can treat the cells, they can actually treat the person as a whole. So this is a little bit more complex explanation about how when inside the ATP is stimulated, then it will dissociate something called nitric oxide, and this will allow respiration. Respiration is, we have respiration like how we breathe, but also in each of our cells we have something called cellular respiration, and that is for the cell to function at a good level. So the cellular respiration can work properly when the nitric oxide is dissociated, and something called reactive oxygen species, otherwise known as free radical, is moved away. So that is something like a detox process. So when we detox the cell, we are actually stimulating the cell to be functioning at a better capacity. Anybody got headache? It's a lot of information, but just to make it simplified, all this means that it speeds up the healing and wound repair. So people who have a diabetic foot ulcer, for example, it should be able to help it. Reduce swelling and inflammation. Some people have leg swelling and they have inflammation, and it increases blood supply and oxygen to the vital organs, and it removes toxins and waste. So these are a few different pathways by which the cold laser can benefit a person. It can work through the blood vessel, and it can promote increase of blood supply. It can increase collagen production. A lot of people who go to the beauty salon, they've heard of collagen, I'm sure. So collagen is on our skin, so it can help to improve the skin. So you can use the applicator for the face, and that can help to stimulate the collagen production. And it can also help, collagen production is also necessary to reduce inflammation. So a lot of allergy problems, skin problems are related to collagen production, and wound healing is also related to collagen production. Then muscle regeneration and muscle atrophy. As we age, our muscles start to get smaller and smaller. If you compare some people who are in their 30s to their 60s, they might notice their arms or their legs are getting smaller. So that is called muscle atrophy. So it can help to stimulate and regenerate these muscles. It can even work to the depth of the bone. I have used it for some patients who have bone infection and have got a good result. Bone infection where they have been taking antibiotic for 1 year and still cannot get any treatment, and they have used the device in under 2 weeks, they have got results. Then cartilage, it helps for the cartilage, nerve regeneration, and inflammation and edema. So this is generally the process. It stimulates the cytochrome C inside the mitochondria to produce the ATP that stimulates the nitric oxide, and that reduces the pain, inflammation, and repairs the cells. So generally it is using oxygen. If you want to understand the concept, you just think about oxygen and feeding oxygen to our cells, and that's how the cells start to repair, and increasing blood supply. As we get older, our blood supply start to shrink, get hardened because of cholesterol and other reasons, aging factor. So it helps to increase the blood supply. For example, when we go exercising, if somebody who hasn't exercised for many years, their blood supply is actually reduced to their organs. Then when they start exercising on a regular basis, they create new branches like a tree. It needs to create new branches. We create new branches to increase our blood supply to a particular organ like the kidney, pancreas, heart. So this is one of the benefits of exercise. So this is what is known as cellular therapy or cellular technology. So now medicine has changed quite a bit from previously giving invasive treatments or externally consuming pills and tablets to recover. Now medicine is more focused on treating and healing from within, from inside the cell, and more on a preventive scale, trying to prevent disease. A lot of us, like for example, you see a healthy, fit person going for jogging, and you think, why does the person need to go for jogging? They're already healthy and fit. But actually, it's the maintenance of health which is important. So the benefit of cold laser therapy is actually, it is also for preventive. So in the future, once more and more people have the awareness of cold laser therapy, they can start to use it on a preventive benefit rather than just on a therapeutic benefit. Meaning to say that healthy people who don't have any illness can use it to maintain their health. Of course, there's other factors also in diet, sleep, and exercise that you have to do simultaneously to get a good result. And that will help on the overall picture for maintenance of health. And this will help to, for example, if somebody is going to get high blood pressure at the age of 35 or 40, it can help to prolong that to a later point. So now we are surrounded by a lot of what we call 21st century disease, which previously we did not have, like high blood pressure, diabetes, high cholesterol, and now a lot of us are familiar with cancer also being very common nowadays. So this is actually all related to cellular dysfunction. Our body is accumulating toxins inside, and these toxins, they cannot clear off fast enough. Our body is not detoxing fast enough, and because of the stress factor, the poor sleep, all the things that people are experiencing in this generation, the poor diet, so this is contributing. So what we need is something to cleanse our system from internal, to clean out the cells, to detox the cells. So all of us are essentially made up of cells. Cell is like the atom, we learn in physics, the atom. So cell will become a tissue, multiple cells become a tissue, multiple tissues become an organ, multiple organs become a system, like a cardiovascular system, a respiratory system, all individually become a system, and then systems collectively become the whole human body. So the key is actually in the ATP. The ATP is about 1,000 to 2,000 mitochondria per cell, and this is a very high ROI. For example, in the mitochondria, there's a process called the Krebs cycle or TCA cycle. That process, 1 ATP, after completion of that whole cycle, can give 8 ATP. So it's such a fantastic phenomenon that we can actually create from 1 ATP cell. After going through this cycle in the mitochondria, it can produce 8 ATP. That means the return of interest is better than any stock market. So this is essentially how a cell looks like. And our body is made up of these cells. There's a nucleus in the center, and all these mitochondria which contain the ATP inside. This is how the mitochondria look like. And all these things inside the mitochondria that contain our DNA information and give us energy, it comes from here. So there's something called antioxidant. Now we have come across a lot of term when we go to pharmacy, or we hear on the radio or read in the newspaper, antioxidant this, antioxidant that. What is antioxidant? Antioxidant is so-called the good guys. We need a lot of antioxidant like vitamin C, glutathione, vitamin E. They are all high in antioxidant. Antioxidant is actually what prevents our body from going through internal stress. So the opposite of antioxidant is free radical. Free radical is what causes a lot of disease, including cancer, high blood pressure, diabetes. All these conditions, even autoimmune conditions, are all linked to free radical damage or oxidative stress. The stress within the cell that leads to problems. So the antioxidant and free radical balance has to be good. Antioxidant level has to be on the high side, and free radical has to be on the low side. So all the things I mentioned to maintain a healthy lifestyle is what will help to keep that balance going. So this is a cartoon depiction of the good versus the bad. So free radical, they have done a lot of research for many years and link it to a lot of disease and aging. So they are basically unstable molecules. So this is a picture of how the free radical is. The free radical is this one here. It's unstable and it lacks an electron. So it goes around damaging cells and then causing cancer and other health conditions by trying to get one more electron from the other cells. And then it tries to get atom from a healthy cell and makes that cell into unhealthy. So it becomes a process. They get more and more. The antioxidant, on the other hand, if their body has a lot of antioxidant inside, it can help to donate an atom or electron to the free radical and stabilize it. So that is one of the benefit of cold laser therapy. It actually creates higher antioxidant in our body, and this will help to reduce the free radical load. This is a picture of how a free radical look like. So this causes damage to the mitochondria. Free radical over time start to damage the mitochondria. That will damage the body's cell function. The cell cannot function properly, and that start to lead to a lot of disease and illness. Make sense so far?
Yes.
Okay. So free radical can damage almost any. This is a very important slide actually. This one shows how the free radical can cause a lot of oxidation stress in our body. And if you see, it can link to almost any condition that we are facing right now is linked to free radical stress. So if we can create a balance for this free radical, it is actually what we can help to improve our health. So you can see from autoimmune condition to diabetes, to acne, to HIV, herpes, cancer, asthma, eye problems, and even heart disease. So these are the common factors that will help to worsen our health and aggravate the production of more free radicals. So unhealthy diet, high in carbohydrates, high in oily fried foods, smoking, either actively smoking or in inhaling secondary smoke, high amounts of stress, work stress, family stress, husband or wife stress, lifestyle which is quite sedentary, lack of sleep also. Lack of sleep is a very big issue nowadays. A lot of people facing lack of sleep. So all this will increase free radicals in our body, reduce the antioxidant. So we want high antioxidant, low free radical. So the ATP reduces free radical. ATP reduces free radical in the body by increasing oxygen. So a lot of new age supplement, new age technology, they are focusing on ATP and trying to reduce and minimize free radical. So using cold laser therapy, we can reduce the amount of free radical, increase the ATP and oxygen in our body. This is an interesting picture, how from 30 to 100 years, we can see the changes, the eyes, the face, the skin, the hair, all these changes that happen. These are the visible changes that happen on a surface level. But this is actually also happening on an internal level within our cell, which we cannot visualize. Sometimes you can do maybe a blood test and you can see some changes, but on a cellular level, this is what is happening. That's why the cells are contributing to the whole body having this appearance. So we can actually help to reduce this process and slow it down. Cannot stop lah, but we can actually help to slow it down, and by reducing the free radical load, by reducing the oxidative stress, increasing the antioxidants. So this is what is oxidation. Oxidation means this is oxidized. This is oxidized and this is undergoing free radical change, and this is not oxidized. So this is the difference that is also can be appreciated on a cellular level. Okay, thank you very much. I hope you enjoyed the talk. So, we are open for Q&A session. Anybody who has any question or any doubt or anything that you want to ask me, please feel free. Oh, so good at the presentation, very clear.
What any side effect for the low level?
Okay, so the question is any side effects lah. There is no. Have you played the flute before or any musical instrument? The low laser therapy is supposed to be as safe as playing a musical instrument. Yeah. So it's actually very, very safe. It can be used to treat almost any kind of condition, to help benefit and improve the outcome of almost any kind of condition. Of course, in some instances, like people who have, for example, active cancer, we don't generally recommend when they are undergoing chemo or radiotherapy to use it during the active phase, or when they are actively taking the chemo or radiotherapy. We don't encourage. Maybe to wait about 2 weeks to a month after that, because it might coincide with the treatment. And also people who have organ transplant, after they have transplanted a kidney or transplanted an organ, we don't recommend.
How about small children?
Small children, yes, there have been testimony of people more than 6 months, patients more than 6 months old who have used it. Go with caution and use it on a lower bar, but it's not going to cause any damage. So it cannot. The laser is not in a potential to damage anything. It cannot damage anything. Yeah. So very safe, very, very safe device.
About allergy, my grandson like allergy, like
Okay.
itch, Sometimes suddenly he say, oh, very itchy here.
Very good for allergy. Just now for the free radical, all the oxidative stress disease, allergy is one of them. So for allergy, patients who have allergy, some patients, they will see the skin specialist many, many times, and then they will take this antihistamine like Piriton, Zyrtec. They keep on taking, and all that is just treating on the symptomatic, but does not give a cellular change. This one can actually give a cellular change. Of course, each person, the result will vary. Some people will achieve faster results, some will take longer time to achieve the result, but it will definitely help to reduce the allergy itch, on a long-term basis.
How long? Is it the adult half an hour?
The recommended time to use it per day is half an hour twice a day.
For the kids or for the 9
For-
years old children?
9-year-old children can use half an hour twice a day, no problem. Yes.
Once
They can start off with a lower intensity. They can use 1 bar, 2 bar for 10-20 minutes, then slowly step up accordingly. Let the body detox. Any allergy produce something called histamine. So you don't want to wash up the histamine too quickly, because sometimes you can make it more itchy initially. So you have to start off a bit more gradual and then hydrate, and then it will clear. Just like when we detox, when you take a detox, for example, like you go to pharmacy, you buy a detox, the toxin has to come out somewhere.
Okay.
So that's why you have to hydrate and take gradually.
Once a day lah.
You can start off with once a day, then slowly increase. But twice a day once they're already used to it, twice a day, half an hour, no problem.
What about 5 years old?
No problem also. Can use, but can use at a lower intensity, 2 bar.
Thank you, doctor.
And cold laser, any help to the person, kids with autism?
Yes, regarding children with autism, there has been research conducted on cold laser, using cold laser for ADHD, for autism. There has been very good studies, because it helped with the neuronal part, the brain. So the synapse in the brain, the connection between the brain is actually linked to autism. But of course, combination therapy with a few other modality might be able to achieve faster results. So they have like a behavioral therapy and a few other therapies also. Combination should be able to give a good result, but you have to use the nose piece. Yeah.
Thank you, doctor.
Some of my clients, they have improved a lot using the laser device, especially for the diabetic clients. But there are 2 who insisted that it did not work for them. So I'm wondering why.
A lot of people, if you ask those people who are distributing the laser device to many patients, they will tell you that one of the main factors is you have to ask the patient about their compliance. Compliance means whether or not they are actually using it in the correct method and whether they're using it regularly. A lot of people will shortcut because sometimes they are rushing for time or they feel like a commitment, like they have other things and then they might not use the nose piece. Actually, the nose piece is which stimulate the stem cells, and very close, the nose has a lot of stem cell and that one will stimulate the brain. So a lot of disease actually is linked to the brain, and the brain control all the pathway. For example, the pain pathway and the pathway for certain disease and everything is linked to the brain. So you have to ask them, are you really using the nose piece? And you have to check with them, and you have to give it about a 90-day period plus minus for them to get any substantial benefit. So ask them to compare. Of course, they will have to also, they just chinchai go and eat everything and really enjoy it, then it's not going to work, because that is going to, a lot of people think that they have a blanket when they are taking this kind of treatment, then they won't follow a proper diet regime or proper lifestyle regime. If they do like that, then they will not achieve a good result.
Doctor, have you been ever met the cerebral palsy?
One moment. Wait a minute.
用麥我比較幫我咧。
Yes, doctor. I would like to ask how about the cerebral palsy. Has this testimony or cases before? How helped for this disease?
There have been instances where one of the main issue with cerebral palsy is the tone of the muscle tone. So there have been instances where the muscle tone, of course, to say completely recover from cerebral palsy is very difficult, because cerebral palsy is something which is genetic and it's quite difficult to treat completely or cure completely from, since it's also a birth-related condition. So it does help to reduce the muscle tone. That means the spasticity, the stiffness of the muscles and the limbs, and to a certain extent also the cerebral function of the brain can help to improve, yes. But sometimes, like I said, for those diseases which are more chronic, more severe, the time to see the benefit might take a bit more longer. So you might have to appreciate to be more consistent, and again you have to use the nose piece for cerebral palsy. Especially this neurological related condition, the nose piece is very important.
Good morning.
Morning.
Okay. My member got this call. I don't know what was the disease, because this one is a nerve problem.
Okay.
This called trigeminal
Neuralgia.
neuralgia.
Okay.
So is it our co-laser can have this kind of disease?
Actually, very good for trigeminal neuralgia. According to the studies, cold laser therapy, they have a big book on laser therapy.
Okay.
That book is, I think, about 400 pages now. So there they have all the research done on laser therapy, and you can see the pictures there. The patient's face is quite badly affected by the trigeminal neuralgia. After using it for, I think, 2 to 3 weeks, they already started to see improvement. Yeah, but of course it will vary. The duration of recovery will vary from person to person.
So of course have to use this one.
Have to use the nose piece. Very, very important to use the nose
Okay,
piece.
thank you very much. One more question.
Yeah.
So I got a friend also got high blood pressure. After using the pressure shoot really high. Why is I have no idea.
Did he check the machine with the digital machine or manual machine? Any idea?
This is my customer.
Okay.
It's just that first time when she used it for the first time, and coincident she went for blood test and do the doctor's check. Is the doctor device shoot up to 220, which is never been there. So she called me and she was in panic. So why is that so? And some of my customers, the high blood pressure cannot maintain. It's like zigzag like that. Why is that? So I know it's under the process. So why is that? So I have to explain to customer. Otherwise, they were in panic. Yeah. Thank you.
So going up to 220 is very high, and it might be linked to other things, like the person might have a bit of anxiety or nervousness, And maybe some people have something called white coat syndrome. White coat syndrome means when they go to see the doctor, automatic they they panic. And when they panic, the pressure will go up. So this may be one of the reasons. I'm not sure about specifically for your client or your customer, but maybe what is happening also is sometimes in chronic disease like diabetes, high blood pressure is chronic disease. Chronic disease means long-term disease. So when they are going through the initial period of using the device, there's something called a healing crisis. Healing crisis or acute phase. So acute phase is actually a healing process. It's part of the healing process that as the healing process is taking place, a chronic disease which is already long-term stuck for many years, not improving, will go through sudden changes because the body hasn't been altered for a long time. When it goes through this alteration, there can be some fluctuation, but usually temporary. Best advice is you ask them to reduce the intensity, use a lower bar and lower time, maybe 2 bar, 20 minutes, continue using the device, and then slowly increase up once the pressure has stabilized. Yeah.
Morning, doctor. I have a question to you, doctor here. Okay, sorry. My friend was one a doctor. She was during birth already. Come up allergic to a lot of foods. Then doing the blood test, more than 1,002 types of foods. Then what I understand now, because quite some time already. She told me that the doctor cannot take bread, cannot take cake, all those type of things. And then she only can take vegetable, chicken, I think more to allergic to carbohydrate or something like that. So all along the doctor's skin with having rashes all over the body. Then I think now the doctor also is from 3 or from 4 already. I think about the doctor when at the age of 12 years old, standard 6, we see a doctor who prescribed her with probiotic. From then on, the condition improved a lot, but still it did have improvement, but then the thing is still going on. It since birth is like that. So I was thinking, is that cold laser therapy, can it be helped? I think it's a bit different from just now the question there. Then one of my colleagues, I also recently only I found that the doctor also allergic, but different type of thing. The doctor can only take organic food. Other than organic food, he cannot take. Also same thing, we're having rashes all over the body. So I'm wondering whether this can help or not.
It's a good question. Actually, there's 2 ways to treat this if you want to approach this kind of a concept. One treatment is like what I was saying, in the future, more people start to use the laser device, cold laser therapy. A lot of these, okay, if you look back maybe 50 years to 100 years ago, right, how many children used to have allergy problem and sometimes even this autism, ADHD, and all, it was not so common. But now it is so common that even the pediatric specialists, the brain specialists, they have to divide to a separate section for the autism and ADHD because there's too many of these patients, they cannot manage. So now they have child behavioral specialists also to manage because it's considered a separate expansion of the pediatric brain specialist center. So what I'm trying to say is that a lot of the change can be on a preventive scale if the person can do the antioxidant and free radical prevention pre-pregnancy to prevent. And then during the pregnancy also, we don't essentially recommend, not that it's dangerous, but we just don't essentially recommend to use during pregnancy, but they can lead a healthy lifestyle, eat healthy foods, and sleep early, do regular exercise, drink lots of water during the pregnancy period. And this I'm explaining is more on a preventive, like to address your question. Now for therapeutic, to treat the condition after already being diagnosed, probiotic is very essential. And there's so many strains of probiotic available in the market. So they have to use a very powerful probiotic which is suitable for the child, and use the correct strain of probiotic for the child, which will help because this is actually essentially a digestive problem. What you're talking about is actually intolerance. They're having an intolerance, and that is leading to the skin problems. It's actually, if you apply lotion, cream, and all these things, it's only treating on the surface. We need to treat the digestive system internally to repair the cell, because the gut is leaking, and this is where cold laser therapy can help to repair the membrane of the digestive system. So the correct place is the child can use targeted therapy over the abdomen. There's actually 4 areas in Chinese medicine which is the very powerful acupuncture point. What IM laser is actually recommending is the Nuguan point. The Nuguan point is at the wrist, about 3 finger breadth from the wrist between the 2 tendons. So the Nuguan point is actually the gateway to our heart and for our blood circulation, which is one of the most important points in terms of acupuncture. So that's how it works through the meridian to repair and increase our function of the laser. In fact, they have done study, if you go for conventional acupuncture, compared to this acupuncture, which is acupuncture combined with laser therapy, the effect of the acupuncture is 50 times more. 50 times more. So it's very significant difference combining the laser with the acupuncture. Now there's other area called Higu, Guanyuan, and Juzanli. So the digestive system is very close to the Guanyuan center. So that is more to the navel, about 2 fingers below the navel. So this is actually where they should do targeted therapy on the digestive system at a low intensity. Maybe start off 1 bar, 10 minutes, then slowly increase to 2 bar, 10 minutes, combined with a few other therapy, which will also include probiotic. There's something called desensitization, where some certain pediatric who are specialized in allergy, they will introduce small amount of the allergy to the patient in small doses over a course of maybe 1 to 4 years long. And this will help to sensitize the person to what is the allergy. But it's a very tedious process. Every week have to go to see the doctor. So if that is not convenient, use the laser therapy with the probiotic.
From the one that you mentioned, that means to say that beside the normal treatment, beside the normal one, we can do the targeted treatment, is it?
Yes. Yes.
Okay.
Targeted treatment to the digestive system, to repair the digestive system.
But also need to do the basic type also, is it, for the kids?
Yes, you can do both. Combination will work better.
Thank you, doctor.
What about things like that? Because I try nutrition. What about we are doing this cold laser, I believe. We are doing this cold laser, I believe. But what about nutrition? We eat for our daily. Every minute our body is working.
Yeah.
So how is it about?
I didn't get your question.
Okay. We are doing this therapy, and then for under control. And what about nutrition to eat?
So,
any
your
particular
diet to eat?
for the children.
Char kway teow and wonton mee. Malaysian diet high in carbohydrate. So you got to have a balanced diet. There are a lot of diet fat, ketogenic diet, this diet, that diet. Just go for a balanced diet. Yeah, you got to enjoy life also. Go for a balanced diet. Eat a little bit of carb, a little bit of protein, a little bit of fat, and then once in a while have your cheat meal. Enjoy also. But if you really want to maximize the potential, you eat a very nutritious diet. High in fruits, high in fiber. Of course, the absorption is very much more better, and you will see much quicker result. Like those people who have more serious disease, if they use the laser therapy with a very good diet, like she was saying just now, like an organic diet, for example, very low in pesticide, and then good quality water, alkaline-based water, or a combination of good quality water with good food and the laser device, you should be able to achieve faster results.
Okay. My son-in-law, about 40 years old, she was 4 weeks, I was struggling with these vegetables. Only plain water with vegetables. So only vegetable like choy sam, then okay. So I blend with some, pumpkin and carrot to make it a little taste. So she will be struggling this for 4 weeks. Because the doctor said she have the gastric, the acid. First they was treating him gastric, and then suddenly very pain 3 weeks ago. And then he went to the hospital, and they check up all these tube and all that, and it seems like the gas is bubbling up. So he was all for weeks this up. But no oil, no salt, just plain water and vegetable and a bit of rice. So then they said, hey, I came here, I don't know what's about, I'm home here. And then what he do is he went to a checkup, I don't know what's the result now. So without salt and without oil for 4 weeks, just plain water and vegetable and a bit of rice. Of course he did 7 apples per day. Too much or not? I think it's
The doctor recommended this diet?
no, she was thinking that to clear out the bubble. So I'm very doubt when I'm doing things.
I would recommend a well-balanced diet. Yeah, well-balanced diet, a little bit of mix of everything. But diet will be according to what the health condition is. Yeah.
So detox lah. Okay, thank you.
The laser, if shine onto the eye, can it damage our eyesight?
This is a 3R laser. So 3R laser, there is a risk if you directly apply it directly to the eye, just like the laser pointer that I was using just now also. But I don't think, unless a child is doing it, I don't think anybody will intentionally put it at the eye directly. So wouldn't encourage, I don't think it's definitely encouraged to do something like that. But if at all, according to the studies, the damage is only temporary. Maybe there will be only some minor blurring of vision, and usually it will be corrected back after that.
Doctor, what about glaucoma and retinal detachment? To what extent the cold laser will be able to help? Thank you.
So I've used the laser device for retinal detachment and got pretty good result, but sometimes the retinal detachment is different stages. So the more advanced stage, if it's very severe, definitely they will need to consider for surgery. So combination therapy normally works best. Do the treatment that the doctor recommend. Use this as an adjunct in support for the retinal detachment. Glaucoma as well. Yes. Support, that means you don't totally stop the eye drops that doctor prescribed for you for glaucoma. Continue the treatment that the doctor prescribed. Use this as an add-on therapy.
Yes, doctor.
I have 2 questions here. Can cold laser therapy help skin disease called pemphigus vulgaris related to autoimmune disease? Second question, can we use 2 or 3 units of cold laser onto a target on different parts of the body?
Who is this person want to do 2, 3? Want to save time, is it? Or it's not a lot of health problem? Okay, never mind. You can. There's no studies. Like if you brush your teeth 10 times a day, or you brush your teeth 2 times a day, I'm not sure if there's any benefit brushing your teeth 10 times a day. So you can try to just use it according to what they prescribe, because that is what the clinical study is based on. So the clinical study is based on using, you can use the device even 4, 5 times a day also, but targeted therapy normally I don't recommend more than 2 times a day, more than 2 sessions, yeah. Targeted, you're talking about targeted therapy? Yeah, so targeted therapy not more than two sessions in a day.
But if
why do you need to over-treat your body? If you take blood pressure medicine 3 times a day, does it mean your blood pressure will be better controlled as comparing to taking your blood pressure once a day? So over-medicating doesn't mean that you're going to get a better benefit.
what about if, let's say, pain management? Is it okay to use few times per day? For pain management?
For pain management, targeted therapy?
Yes, correct.
No clinical study proven that it's going to give you better relief by using it multiple times a day, but this is on a personal level. what I can recommend to you is on a clinical level. Clinical level means what research has been done. So you can have personal opinion where people say, oh, I use 5 times a day, oh, fantastic, a whole day, one day already recover. But this one is depending on each individual. So of course, as I said, it's generally quite safe and shouldn't have any issue. But if you overuse it, also you may not get any benefit, or you may get benefit. But this is an individual basis.
People with cataract operation, can you use it? One question.
Can.
Second question, there's this lady, she had an eye transplant. Somebody donated a cornea for her. So she's afraid that it may damage that cornea, which is so difficult to get, to have it transplanted. So she's so afraid that it may spoil the cornea, which has been donated. What do you think? Can she use
any form of organ transplant, there is an adaptation for the body to adapt to somebody else's organ. So for example, somebody who takes a kidney from somebody else, they have to take certain medication to keep their immune system down. So this is actually improving the immune system. Then you take something that is counteracting with the laser device. It's not recommended. So not recommended for any form of organ transplant. Cataract can, cataract off can.
Doctor, for 80 over years woman, she has a very sort of weak heart, and then I think she has a valve or something. Do you advise her, can you advise whether she can use the IM laser?
80-year-old lady with a weak heart.
The doctor says she has a weak heart, so she go back for checkup quite regularly. So it has a valve, something like that, on connected. She didn't. I only know that she has a valve connected to the heart, so she has to go back for very regular checkup. So
you ask her if she wants to live until 100 years old or not. then she can use it. Safe. Everybody is safe 6 months above to 150 years old.
Doctor.
You haven't answered my first question.
Wait, just hold on 1 second. I just want to check the time because
Still got time, it's okay.
Just now I asked about the skin disease, pemphigus vulgaris, related to autoimmune disease.
Pemphigus, yes. Pemphigus can, autoimmune condition can, but start slow because any kind of autoimmune condition, the immune system is weakened. So if you go too aggressive, too many targeted therapy, like you said, 2-3 places and all this thing,